And then this is just the whole reimbursement scheme for the doctors as we now have it is, as I was talking about, is rewarding technology over talk. And then we have also, in the doctors, there's concern because there are doctors out there who have commercial interests and ties to the procedures they may be doing and to some of the things they may order. They may have co-owner of the clinic that they're running, and they may own the MRI. Well, you can bet they're going to do more of those procedures. So that's another thing to be concerned about. The for-profit part of it is also affecting doctors. And we've found that this is actually very regional. And we know already that there's a big discrepancy in Medicare payments across the country, Medicare costs across the country. I don't know how many of you know the article that was in the New Yorker this year. It was a kind of a famous article that came out about in June by a doctor named Gawanda, who went down to a town in Texas that has the highest reimbursement rates for Medicare in the country. And he went down there and said, what is going on in the McAllister, Texas? I think that was the name of the town. And, why are they so high? And they have the same demographics as nearby El Paso, and yet their costs are so much greater. What is it about their patients? And what he discovered when he went there was there was an MRI on every corner. The doctors were owning the hospital. All these people were kind of in cahoots together with these commercial interests, commercial ventures. And their charges were much higher than other places. And he looked at what's the lowest. And it's places where they have organized clinics where people cooperate and they work together, like Mayo Clinic or Cleveland Clinic. Washington State actually does it very well when you compare it with other places. Washington State's Medicare bills, for example. Medicare is we talk about Medicare a lot because we have information on it. We don't have information on all of it. We don't have the data on the private insurers and what things cost. But we do have a handle on Medicare and Medicaid. So in Washington State, our charges to Medicare are 14% below the national average. Whereas in Florida, they're 11% above. It's not a matter of, but they've got way sicker patients than we do. I know they've got a lot of retirees down there, but if you factor that out, that's not what it is. It's overutilization is what it is. So, and I know, Maria Cantwell has a bill on this and to try to even things out in the Senate. And I don't know if that's going to be part of the final bill, the big healthcare bill, or if she can introduce that separately. But I think that's something that's really important. Our reimbursement of Medicare is a lot less than Florida's. We charge less, and so we get less per patient than they do. That's the way it works, and that's got to change. Okay. So we get punished. Our outcomes are at least as good, if not better. And there was actually a New England Journal article that just came out yesterday. I just got my issue, and it's fascinating. It looks at, if you take the quartiles of charges to Medicare, you take the ones that are the highest in the country versus the ones that's 25% highest versus 25% lowest, and they factor out the factor out the degree of sickness of the patient, the race of the patient, the poverty level, everything else. Those are not the things that make the difference. The difference is in where you live, and it makes up 70% of the difference in cost. So it's huge. Anyway, then in the services area, we have the investor-owned clinics. We have for-profit medicine. Extremely commercial, and we've all seen it develop during our lifetimes. You get into the diagnostics, extremely expensive expenditures, especially in radiology. When you get into the PET scans, the CAT scans, MRIs, nuclear medicine, we're spending a fortune on these things, and we're doing too many of them, more than we need to be doing. And we get into the cost of the treatments, the technology. This is where we need to save money, a lot of where we need to save money. Computerized medical records, I didn't know quite where to put it, but that's cost up front, and it certainly has benefits to the entire system to do it. But it is a cost. Okay. So what this comes down to, in summarizing what we're dealing with here when we're dealing with trying to make healthcare reform, is basically we've got the big corporations against the people. And that's really what it boils down to. And this is, you can't see it